Hello, I'm Dr. Tom Ransom, and I'm the endocrinologist on the team. I'm on the sugar side of things, and I work with your obstetrician who's on the baby side of things. And you've been diagnosed with gestational diabetes. That means diabetes just during pregnancy, during gestation. And I do hope it's been explained to you that this is not your fault, it's not the baby's fault, it's the placenta's fault. And well, we say that, but the placenta really always wants to make sure that there's sugar for the baby. And sometimes it does that too much, and that's been explained to you why we really don't want too much sugar. During the first half of the pregnancy, the placenta more or less just steals sugar from you to give to the baby. That's plan A. During the second half of the pregnancy, it moves into plan B. And that's where it puts out hormones into you to cause your body's own insulin not to work as well. We call that insulin resistance, and that's often where we have to help with medications such as metformin or maybe giving you insulin. Now, this is all in the background. I don't know if you know this, but your liver is a big sugar-making machine. In between meals and overnight, all the sugar comes from your liver. You may have heard of someone going on a hunger strike for 3 weeks. They're protesting something and they don't eat. They don't go low because the liver keeps making sugar. The reason I mention that is you can't starve this away. Your job is to eat healthy, and then we work the medications around this. Now, metformin, if you're taking metformin, it is safe during pregnancy. It's a medication that's been around for over 80 years. Some women even take it who have polycystic ovarian syndrome as a fertility agent. You may even know someone who's done that. And if they conceive while taking metformin, we actually recommend that they stay on it for the first trimester, if not the first half of the pregnancy, because it's so safe. Now, if you have to take insulin, that could be quite daunting. That makes sense. But we have a whole team helping you, and we will teach you to the point where you can teach others. I don't know if you've seen someone take insulin before, but you're not drawing up in a syringe and going into your veins. It's a device, we call it a pen, where if you say take 12 units, you click up to 12, and you inject it. It's just a little tiny needle, hard to see, into your stomach. You don't have to worry. Your amniotic fluid's not going to come out. After your first injection, usually a lot of the appropriate anxiety just goes way down. And at the end of it, most people, 99 out of 100, say they didn't like poking their finger, but the insulin wasn't that bad. And we'll be following you closely throughout the rest of your pregnancy, as long as you send in your sugars. And if you have any questions, we always tell you to add that into your emails. And really, this is, from our point of view, we anticipate this will go really well. And all the best on your journey.